Hi everyone, my name is Ai Hang Fu. I'm a physical medicine and rehab physician here at Mercy One. Thank you for joining our YouTube channel. We hope to bring you monthly videos that are of interest to you and that are short and informative for improving your quality of life. Today our talk is going to be on falls. As you know, falls are very common. We often evaluate whether people have fallen during our clinic visits on a regular basis because falls can lead to injury. There are 3 million visits to the emergency room by adults greater than 65 every year because of falls. Falls, we know, are the leading cause of traumatic brain injuries and fractures. So these injuries can certainly lead to change in function and a change in quality of life. So we'd like to work on the prevention of falls. Let's talk about some of the causes of falls. We know that weakness, especially in our legs, can lead to falls, numbness, changes in balance, and pain. We evaluate all of these symptoms when you come in and see us. We try to figure out what it is that, number one, is causing all of these, if they're all related or if there's one particular reason. Oftentimes there's multiple reasons as to why people have these symptoms. Our goal is to work on identifying them, figuring out what we can do to improve those changes: weakness, numbness, balance, and pain, and hopefully prevent falls. Medications, especially when we're on multiple medications at a time, can lead to falls. Medication changes that have been done recently can lead to falls. Also, dosage changes on current medications can lead to falls because our system is not necessarily adjusted to them. Poor nutrition has a role to play in falls. Changes in our electrolytes, our vitamins can certainly lead to falls. Our environment, both indoor and outdoor, have led to multiple falls. We'll talk about that in a little bit as far as how to prevent it. But think about it. Inside, we have lots of things: rugs, furniture, animals sometimes. These can lead to falls. Outside, we have steps, uneven terrain. The environment itself may be slippery or icy. That can lead to falls. Crowding can lead to falls. Hopefully right now there aren't too many crowds around, but in a sense, we can't really manage what other people do, and sometimes they run into us, and that can cause us to fall. Changes in vision, limited vision, can lead to falls. How do we change our frequency of falls? How do we prevent falls? Certainly, if we have any of the weaknesses, especially in our legs, we can work on strengthening those muscles. A lot of times during our physical exam or my physical exam, I find that people have weakness in their hip flexors, the muscles that bring the knee up to the chest. These muscles are often used when we go up steps or try to lift our legs up to clear something on the floor. If we're unable to use this muscle very well, our legs just don't move as well, and we trip or we fall. There's several exercises that we can do to work on strengthening the hip flexors. In addition, our thigh muscles, both front and back, as well as our gluteal muscles, our calves. These are all muscles within our lower extremities that, if they are weak, they can lead to falls. So strengthening and identifying the reason why they're weak is certainly our role, and we can certainly help you identify that if you come and visit us. Numbness, balance changes, and pain, these also, they coexist sometimes together. They also can be a result of underlying medical conditions such as diabetes, type 2, or changes in our thyroid. So sometimes we encourage, strict management of underlying medical diseases to help prevent the worsening or the progression of numbness, um, which then can lead to our change in balance. Pain in general can lead to falls. It doesn't necessarily need to be in the legs. Somebody with a severe headache can have a fall because they're not necessarily cognizant of their environment. And so their balance is off, or their vision is off, and hearing is off, and this can lead to falls. So managing pain is also important. This can lead to changes in medication, like I said. Oftentimes, when medications, not only prescription medication, but over the counter medications, when they're taken, depending on the frequency, the type of medication they are, and how your body metabolizes them, can lead to changes in how our body functions. A lot of times, medications can interact with one another and make us very drowsy or disorient us, which leads to falls. We do have a clinical pharmacist within our clinic as part of our team, who is more than willing to review medication lists with you. And if that's of interest of yours to have that looked at, you can let us know if you come and visit us. Poor nutrition. Oftentimes I talk about having a good nutrition. Not many people, I should say that everybody kind of has different eating habits. I promote moderation in terms of dietary habits. But the key is to make sure that you have, basic good nutrition, so that your electrolytes are balanced, your vitamin D levels are within normal ranges. If you follow a certain dietary restriction, that needs to be addressed. All of these things can be addressed by us as well as your primary care provider. Let's talk about environment. Inside, we often have throw rugs. Especially in the bathroom, there's a lot of loose rugs. It's a slippery floor environment sometimes. This is often a location of multiple falls. So I usually recommend getting rid of those throw rugs. Let's put in some grab bars, especially by the toilet or by the shower or tub, whichever you have, to allow you to hold on to have better balance so that you don't fall. Steps often are a culprit for falls, especially going down into the basement or outside. Having railings is very important. Also, having a hand free to use these steps is important. Oftentimes we take laundry to a different level using a laundry basket, and therefore our hands are not free. So making sure that you have a railing to hold on to, and that you're not carrying something that's too heavy that requires two hands. Getting steps fixed is really important, especially if they're outdoors and they're unstable, or if they're made of stone or wood and they're in disrepair. This can certainly lead to falls. Choosing our activities wisely can help prevent falls. A lot of times we have people coming in who have fallen after they've gotten up on a ladder, trying to do something on their own. Let's think twice about the choices we make, especially if we're trying to do something that involves height, getting up on our roofs, using a ladder, or if we're trying to reach up high for something and we have to stand on a step ladder. This can lead to significant impairment after we fall. Poor vision, I talked about. Vision in general is important for our bodies to know where we are in space. And if we have lack of peripheral vision, kind of seeing the items around us, that can change how we move around, and we might not see things in our way. Getting our eyes checked annually, looking at whether we have cataracts and if that can be repaired, that can help as well. Putting up good lighting, using good lighting can help within our home space or outdoors so that we don't fall. The other things that I often recommend are assistive devices such as canes or walkers or wheelchairs. I have some patients who are very open to that, willing to use it. Others not so much, very independent. So these are patient to patient basis, but certainly at times their assistive devices can help in the prevention of falls. There are several other things that we can certainly talk about as far as the causes and the prevention of falls. This video was meant to kind of just give you that brief overview, hopefully provide some information, whether it's new or review. I hope it's been helpful. Please send us information or questions that you have. If there's any other topics that you want to talk about, send us a message or let us know when you come visit us. I hope that in the future we can be just as informative and give you whatever information that you're looking for. And if you want to come and visit us, we're at Mercy One Physical Medicine and Rehab in Clive, Iowa. Thank you so much. Bye-bye.